Well, welcome back to Great Day Washington. Today we welcome a leading auto accident and work injury specialist in the D.C. area, Dr. Stephen Davis. Dr. Davis joins us from Capital Accident Care Center, a place that specialized in treatment of personal injury cases for more than a decade. Welcome to Great Day.
Thank you for having me.
Now, when people talk about personal injury and accidents and car accidents, you like to triage their cases.
Correct.
But what does that mean for someone who's been in an accident and they don't know anything about the system?
Right. Well, with triage, we're looking to determine, basically the priority of treatments, and that's going to be based on the severity of their injury. So when someone comes to see us after a car accident or work injury, we want to fully understand the extent of their injuries, and at that point, we can then figure out the best possible treatments for them.
Okay, many people may think of an accident and they think of broken glass and metal all over the road, but that's not always the case. Can you explain?
Right. People think that car accidents have to be extreme in order to pick up injuries, and that's a pretty common misconception. Some of the worst cases we've seen in the office have actually been from low-speed fender benders. And what's interesting is often it takes a couple days or even weeks for their symptoms to appear, and that's why it's so important to get evaluated right after an accident rather than waiting.
And would you recommend someone come and see you first or go directly to the emergency room?
Well, quite often we actually have people come to us after they've already been to urgent care or emergency room. And what happens there is they're going to rule out fractures, dislocations, head trauma, things like that. And when they're discharged, they're typically going to be given medications that help deal with the symptoms, so things like anti-inflammatories, painkillers, muscle relaxers, but no treatments are generally given. So when they come to us, whether they've already been to urgent care or not, we want to do a thorough evaluation. We have x-rays on site that we can take if they're needed, or we can refer out for more advanced imaging like MRIs.
Dr. Davis, it sounds like you offer a very specialized approach, but can anyone go to any doctor and receive these types of injury evaluations?
Well, the short answer to that is no. For most doctors, this isn't their specialty. So while they can prescribe medications to deal with the symptoms, they're not going to give treatment. And as anyone who's been in an accident can tell you, as soon as the medications wear off, the pain comes right back. So when we have someone come to our office, we do a full evaluation so we can determine the root cause of their pain and symptoms. We treat that, and the end result is that not only do they feel better quickly, but they stay out of pain, which is really important.
And no one wants to be in pain long term, and definitely not the rest of their lives. But from my understanding, some doctors won't even take a personal injury case.
Right. A lot of offices aren't really equipped to deal with all the things that come with personal injury and workers' comp. Things like med pay, personal injury protection, auto insurance, third-party insurance, attorneys, paperwork. It creates a really big headache. At our office, we have a fantastic team. They're very experienced at dealing with those things. So we like to take the approach where we deal with all of those problems so our patients can focus on getting better.
And some people, and I know this personally, when they're in an accident or they experience some type of impact trauma, they worry about getting to work on time,
Right.
They worry about fixing their car,
Right.
and they neglect their bodies.
Of course.
I don't know why we do this, but what are some of the treatments that you serve? As you mentioned pain
Right.
at your clinic. Can you elaborate?
Well, the scope of injuries can vary widely, so there is no one-size-fits-all approach. We offer things like massage, spinal traction, joint manipulation, rehabilitative exercise, dry needling, and for the more severe cases, we have advanced therapies like infrared and cold laser therapy.
Ooh, this is good, and this is interesting here. Advice for anyone watching out there who has been in an accident.
My best advice is not to wait. Whether you've been in an accident a few days prior or weeks or months, if you're feeling pain, it means something's wrong. And the longer you wait to fix it, the longer it's going to take to feel better. So, we have an excellent team. We're happy to help anyone who has an issue. So if this is sounding familiar or you've experienced it before, pick up the phone and give us a call, please.
I think that is such a warning sign. If you feel pain, that's your body telling you something's wrong.
Exactly.
And you're here to help. I understand
Right.
you're rushing to your office right now
Yeah.
to help people. So he will be there right at
Yeah.
10 o'clock. And for more information on how you can receive help, just call the number on your screen. That number is 240-224-3700. Or you can visit capitalaccidentcare.com. The next 25 callers qualify for a no-cost, no obligation auto or work injury evaluation. This segment was sponsored by Capital Accident Care Centers. Thank you so much, Dr. Davis.
Thank you.
Now let's send it out to Andy.